Hello, and thank you for attending our webinar on Synexus electric cell signaling technology for neuropathy. We will be answering questions at the end of the webinar on our clinic's most frequently asked questions, so feel free to message us if you have any further questions, and we can go back to you as soon as possible. I'd like to introduce our presenter, Dr. Santucci. For those of you who don't know, Dr. Santucci is the Clinical Director of Advanced Region Medical Incorporated and Neurointegrative Care of Los Gatos. He received his BSBA from Georgetown University. Dr. Santucci expanded to learning systems, studying over 1,000 hours of functional neurology training with concentrations in functional neurology with the Carrick Institute, as well as rehab of vestibular systems and childhood development delays. He has taught advanced diagnostics and clinical interventions to medical doctors and their staff. He has taught at the American Functional Neurology Institute, Health Centers of Future Platinum Conference, and the Applied Functional Medicine Institute's Technology Conference. I will now hand it over to our presenter, Dr. Thomas Santucci.
Great, thank you, James. Today we're going to be talking about peripheral neuropathy, or more specifically, the technology that can address peripheral neuropathy. It's kind of an amazing thing because in 25 years of clinical practice doing, holistic orthopedics and advanced neurology, I wouldn't say that I was ever really successful at directly addressing peripheral neuropathy. In conventional medicine, it's considered an idiopathic disease, meaning we don't really know all the ins and outs of it, and it's not really a curable thing. The conventional treatments are gabapentin, maybe other painkillers, neuropsychological stuff. But from a neurologic point of view, there was very little being done. So we're going to discuss that. We've worked over a year to bring this technology to the clinic, and I will say it's, if there is a breakthrough technology, just like pulse electromagnetics was the breakthrough about 5 years ago, lasers were the breakthrough about 10 years ago, this is the new breakthrough. So this is actually technology that can fix the inside of a nerve. Some of the things that are really spectacular about it is that they've gone through the FDA clearance process. So this is FDA cleared. And some insurances, including Medicare, actually cover it. So this makes this accessible technology for peripheral neuropathy. So we made a little animation. These doodlies are helping us give lots of complex data in a short amount of time, and everybody likes them, so enjoy.
Peripheral neuropathy causes damage to the nerves, resulting in burning, sharp pain, loss of balance, numbness, pins and needles, and tingling in the affected area, most commonly seen in the feet and hands. This condition is progressive, so it will get worse over time if it is not treated. Nerve signaling in neuropathy is disrupted in 3 ways: loss of signal sent, like a broken wire, inappropriate signaling when there shouldn't be, like a static phone line, and errors that distort the messages being sent, like a wavy television picture. Until recently, treatment options for peripheral neuropathy have been limited because most medical professionals do not want to or know how to treat neuropathy. They would simply prescribe medications and tell patients to deal with it. Well, not anymore. Breakthrough studies and over 30 published medical articles have surfaced with an FDA-cleared treatment that is safely and effectively treating neuropathy and is covered by Medicare. This breakthrough treatment has 3 simple target goals: increase blood flow, reset the small fiber nerves, and aid in nerve repair. This results in reduction or even elimination of pain, numbness, burning sensation, and loss of balance, with some patients seeing neuropathy symptoms diminish within their first week. This leading-edge treatment is called the Synexus electrical cell signaling system. Doctors developed the system to effectively treat neuropathy symptoms that resist medication. This system provides highly specific signaling for muscle strengthening, efficient neuromuscular re-education, and relaxation of muscle spasms. The Synexus electrical cell signaling system, along with vascular cupping, delivers energy to the affected area of your body at varying wavelengths, including both low-frequency and middle-frequency signals. It also uses amplitude-modulated AM and frequency-modulated FM signaling that automatically changes simultaneously during treatment to deliver the electrical cell signaling energy. This system is typically paired with vitamin injections that assist with nutrient deficiencies seen in those with neuropathy and supports healthy nervous system function, creating a complete program for optimal results. The amount of treatment varies from person to person. A consultation from your Synexus neuropathy treatment provider can determine the best treatment program for maximum efficacy. As long as the patient has not sustained more than 95% nerve damage, the treatment can be effective. Call us today or visit www.advancedregion.com to begin your journey toward neuropathy recovery. Call us today or visit www.advancedregion.com to begin your journey toward neuropathy recovery.
So I want to give a shout out to James and to Cecil, who are responsible for putting that animation together. I think it covers a lot of the points really well. One of the things that we're looking at when we're talking about a disease that's part of a bigger disease is that there's always a part, in this case, that the technology does. There's the part that the patient does, and basically we're a regenerative stem cell clinic. We think almost all these people should either be doing PRP or stem cells or some kind of other advanced treatment. But there hasn't been anything in my experience or almost in any of the literature that actually addresses the repair of the axon of a nerve as directly as this does. So let's take a step back and actually look at neuropathy. So most neuropathy in the United States is diabetic neuropathy. So when you're looking at a nerve needs fuel and activation to run. So what's the fuel? It's oxygen and it's glucose. So in this country, we have an epidemic of people with too much glucose in their blood, not in their cells, in their blood. So the diabetes, the pre-diabetes, the multiple stages of diabetes, the sugar handling stress, the different names for too much blood sugar, starving or damaging nerves and tissues is an epidemic. A lot of this is secondary to autoimmunity. We're certainly advocates of looking at the food antigens, the gluten, dairy, egg, yeast, soy, the metals, the hormones, the stress, the pesticides, poisons. Chemotherapy is, basically a platinum derivative, cisplatin, that takes the oxygen away from all the tissues. So its intention is to kill cancer cells, but it kills a lot more than cancer cells, and it starves nerves of oxygen. And then there's certain medications like statin drugs, which demyelinate nerves, that actually take the myelin coating, the sheath, off the nerve and can cause peripheral neuropathy too. There's a lot of people on statin drugs with relatively low cholesterol numbers that are damaging their nerves. So when we see a person with borderline sugar handling stress that's on a statin drug that basically doesn't understand glycemic index or the way sugar handling is met, we see that as a candidate that we can make some lifestyle changes in addition to the technical, applying the therapy and make some big changes. When we look at the symptoms of neuropathy, this gets to be a confusing thing. I just had a patient the other day that was a English professor, and he was probably the first person that could explain all the different derivations of numbness and tingling that this thing presents as. So in Latin, it's called a paresthesia. So on or about, and then esthesia is a feeling. So in sort of like colloquial English, it means a funny feeling. So what happens is there's a sensory deprivation to the brain. Your brain isn't getting the proper signal. And what happens at that point is the brain actually makes up signals. So you get feelings that you've never had before. So peripheral neuropathy in its simplest form can be pain, numbness, tingling. But we've had people say, it feels like ants are going up their arm, or it feels like an absence of feeling, but it's actually painful, or it feels hot, or it feels cold. And those are all individual brain interpretations of what's going on. If we have a circulation problem, then we can literally have cold. If we have inflammation, we can literally have hot. But these paresthesias don't match the actual physical state of the body. So, and you would think numbness or tingling, no big deal compared to pain, these are the people that are the most upset by this, because it's not only confusing, it's irritating and it's distracting on a pretty significant level. So when you lose sensory input, there's a neurology saying that afferents breed efferents. So the sensory part of the input to our brain helps control and influence the motor control of your whole body. So this thing can turn into motor control problems, lack of coordination, neurovestibular problems, in general, balance and coordination problems. So now we have a 70-year-old who can't feel their feet, doesn't really know where their feet are, and they don't have enough muscle control and neurologic feedback to, essentially create a balanced state. Therefore, we have a significant potential for injury from falls. And we know, I remember one of the things when I went to medical school, there was a horrible statistic that basically said if you're 70 years old and you fall and you break your hip, there will be a 30% chance that you will die that year. And what you'll die of is an infection in the hospital. Well, after 27 years, that number is now 40% chance you'll die in the hospital that year. So one of the things we not so facetiously put out there is don't fall, which means that you have to have physical control. You have to have enough strength in your legs. You have to have enough neuroproprioception. And the signals from your feet, hips, knees, shoulders, brain, all have to summate to a signal that actually matches a reality you can control. And this is something people can actively work on and something we're very interested in getting for most people. So when we talk about conventional treatments, basically Neurontin or gabapentin is the conventional drug for this. And then other drugs, which are off-label usage. It always amazes me how many drugs are actually being used for something they were never approved for. But antidepressants like Lyrica are being used for peripheral neuropathy. And, even if they do some good, there's other things that would work much, much, much better. And the conventional world is just so slow to even change their medications for what would work. When we're looking at breakthrough technologies like Synexus, where we're actually talking about changing the axon firing of the inside of the nerve, this will be 10 years before conventional medicine picks up on something like this. On rare occasions, surgery is being used, and that's in the occlusive states. So if there's like a pinching or if there's a sense that we can just turn off the nerve, then sometimes they'll provide a nerve block, which is, really should be a last resort, or some kind of a surgery to prevent an entrapment syndrome. Those surgeries have major complications and they're not altogether successful. It's a pretty dangerous way to go, in my opinion. So when we're looking at Synexus itself, the Synexus has 3 goals. 1, to increase the blood flow, to reset the nerve firing, and to actually aid in the nerve repair. And the technology itself is set up to radically vacillate so that the system can never get used to it. So one of the things we did is we put together this chart and basically describing the 3 different kinds of modulation of the signal. So the first is amplitude modulation, how high the signal goes. So one of the things that happens if you're trying to remodulate a nerve or myelinate a nerve, you're trying to make the nerve work better, you have to switch up the signal. If there was music in the background and we all listened to it for a whole day, at the end of the day, we wouldn't hear the music. Our brain would just white it out. So the nervous system does that with almost any signal. So almost every signal gets habituated. So what this does is it prevents that from happening. So it changes amplitude modulation. It actually changes the frequency, the beats per second. So it goes slow and then it goes faster. And then it does something called phase modulation or frequency hopping, and it actually moves from place to place to place. The net effect is instead of a stream of electrons like you see in normal E-stim, we have much more like a tube or a plasma level of electron force that can be directed. So part of what we do is we pick the targets. So a lot of times we're putting, big diodes on the person's back, so it acts like a capacitor coming from the sciatic cluster, the L5, S1, kind of big nerves that go down your leg. And then the target, the knees, the inside of the leg, the feet, whatever it is we're trying to get. And the amount of power is one of the things that differentiates this treatment. I can remember 25 years ago, we were using, TENS, transcutaneous electrical neurostimulation devices. And even the commercial ones were relatively low power. This is hundreds of times more power than that, and yet way more gentle. So it has a cupping diode. So it has a vasopneumatic cup that actually pumps the tissue. So we put 4 of those on. And then it has an electronic part that actually does this electronic cell signaling. The two things together address kind of the two concerns we have with nerves in neuropathy. So technically, it's the best thing that I've ever seen. And it basically has been designed really just for one purpose, to go in and reset the axon of the nerve. And, it's one of the things that we're seeing in a breakthrough technology in a regenerative clinic where stem cells, PRP, have replaced many, many, many orthopedic procedures and many, many, many rehab procedures. This is standing alone as being, a really kind of a standout technology to address neuropathy. So certainly one of the big features of this is that it's FDA cleared. I think we have to be careful about the word FDA approved, but the approval or the clearance is for pain conditions. So this is considered electroanalgesia, but it's also for post-traumatic pain syndrome, so car accidents or surgery problems, relaxation of muscle spasm, retraining of muscles and nerves, prevention of muscle wasting. That's about everybody. And then maintaining or increasing range of motion. Again, one of the things that we do is we're going to measure the strength and range of motion and then measure it over 3 visits. So again, in stem cells, we're getting about a 45% increase in those indicators. In this, we're getting about a 30% increase. If we do the two things together, we can get much, much higher numbers. We're increasing, or one of our other goals is to increase local circulation, and then prevention of disease. And it's interesting because for the first time almost ever, Medicare and the FDA are going with a preventative strategy. So this is something that not only stops acute pain, paresthesia, this is something that will prevent a future problem and rebuild actual tissue with numbers. So we get asked a lot, is why is there a range? Why are some people doing better and why are some people not doing as well? Well, again, I think we have to use peripheral neuropathy and use diabetic neuropathy as our guide. If your blood sugar has been balanced, we're going to have the cofactors that we need to create a healthy nerve flow. If we've got a bunch of excess serum sugar, then we're going to interrupt the cell operation in a pretty significant way. Alcoholic neuropathy can actually damage the tissue, like as bad as a car accident. I saw a patient last week and complete degradation. It looked like a necrosis of the calf muscles in the back of the leg. And that's what the alcoholic neuropathy had created. In general, and in an appropriate way, we want to incorporate some kind of gentle exercise. We don't think 70-year-olds should be jogging. It's just, we want to be realistic about that. But at the same time, we want to keep that system moving. We want to keep the firing going into that system. The more the brain understands that things are normal, that you can move, you can exercise, you can react to reality, the more it generates healthy tissues. The body responds to imposed demand. We want to keep people moving and active. The treatment schedule is usually twice a week. We really don't have compliance problems with this. Most patients see a change in a couple of weeks, and it's a building kind of a thing. Most people are doing between 20 and 40 visits. One of the people that are 65, generally Medicare is paying for it. The other people were doing self-pay plans, and both of those things are working just fine. So the bottom line on this is that it's been out for about a year. It's definitely in the new technology world. In the beginning, we were concerned how it worked with other therapies. It seems to work fine. We're doing this with stem cells. There's a lot of literature on this from the FDA approval and the 30 published studies. I'd say one of the things about this is that it's become an accessible answer to diabetic neuropathy. And again, we would have this be the first part, then we deal with the sugar handling stress, and then we deal with activities of daily living like exercise. And I think if you kind of take it in a 1, 2, 3 gradual approach, you can actually step back from one of the most debilitating diseases in the United States. And, again, there's a lot of concern these days about death rates. And, if we took all the COVID deaths and put them in a scale, they'd be about an inch. If you took all the cardiovascular deaths this year, you can't fit them on the screen. So when we're looking at diabetes contributing to heart disease and ultimately death, it's a significant health problem. It causes more problems and more lives than any other prevalent disease. So we're now talking about a way to clinically kind of stop that forward motion of that disease and supply some tools to the patients. The fact that it's covered by Medicare is just amazing. And just a word on that. I mean, I remember, I'm the son of a physician, and, we've got 4 or 5 doctors in my family, and we basically viewed Medicare in the past as being kind of a thing. Like, they weren't very insightful. It wasn't the best technology. It wasn't really what we wanted to go with. And now we're looking at regular Medicare, like Parts A and B with a supplemental, as being the leaders. I mean, they're really doing some good things. From a, let me just say, diagnosis and kind of patient record keeping point of view, they've shifted from you have to do this whole huge physical, like 2 items and 9 different things, to explaining the medical necessity of what you're doing. In a functional medicine clinic like ours, we really appreciate that because that's been our emphasis all along. So one of the things that we do is we do a thorough exam that actually says, here's the basis of the condition, here's a treatment plan that's going to actually address it, and then here's something that we're going to track as we go along. So, I'd say for the first time in a long time, the Medicare-covered insurance may significantly exceed the really efficacy and really common sense of almost any offered product. So we're getting a lot of questions, and we've done this for a while, so we get some basic questions. So I had James put together a list, and we're going to go through like some of our most common questions. If you have questions, you can send them in to us. We're going to pre-record this, and then we can cover those in our next webinars.
How's it going, everyone? This is James again. So we've got a lot of questions here. We have a couple minutes to answer a few. The first question we have is, how is Synexus different than electric stimulation or TENS unit?
So it's different, but the same. So it's electrical stimulation. So let's just lay the groundwork. Transcutaneous electrical neurostimulation is kilovolts. So it's tens of thousands of volts. So pretty high levels of electricity. It's like electronic aspirin. It will stop pain. Microcurrent, which is millions of volts, can actually rebuild tissue, but you can't feel it. So from a healing point of view, we like microcurrent more than TENS. Although if you've got a bunch of pain, TENS isn't a bad thing to do for a couple of days. So it's using that same technology. There was a technology in the middle, and it's actually about 80 years old. So you have a stream of electrons in your therapeutic stream, and you interfere with it. You take another set of diodes and you actually interrupt the signal, and that's called interferential. So in some ways, Synexus is the next generation of interferential technology. And everything's built on something. It's not like it dropped out of space and we all of a sudden got something that's as good. But what's happening is there's plasma level, almost rife level frequencies and pulse electromagnetic influences, so that this stream isn't like this long anymore, or this wide anymore. It's not like a one-dimensional stream. It's like a ball. And so when we're moving the energy, we think of it as being about 8 or 9 inches wide and with a vacillating current, almost like an eddy within it. So it's similar, it's based on a lot of these other technologies, but it's much, much, much more powerful, and it's much, much, much more complex. Without losing everybody, it's actually quantum level healing of the axon at the subatomic level. So there has never been anything as kind of technically fancy as this to fix the inside of a nerve.
Thank you. So our next question is, how long has this been available? What's the history?
So again, it's a buildup of the last 100 years of electronic stim. Remember, about 100 years ago, they got really good with electricity. So Tesla, a whole bunch of people, X-ray was developed. And basically, they were doing this kind of therapy in those days. It was very, very, very crude. I would say, again, this is the most modern derivation of electronic stim, and it's the first quantum level therapy. Basically, it's been commercially available for about a year. We've been doing it for about 8 months. And, you have to do it long enough to kind of see what's going on with it. We were thinking we were going to use pulse electromagnetic with Synexus. Synexus is powerful enough to actually just fix the nerve. We're looking at an 80-85% success rate just doing the Synexus. When people are doing either stem cells with it or making the lifestyle changes, it almost addresses everyone from a symptom point of view, a strength point of view, and a coordination point of view.
Thank you very much. Looks like we have time for maybe 2 more questions. Our third question is, how does it repair nerves exactly?
Great question. So exactly is always tough at the subatomic level, but it does 3 things. So it increases vascularization, so the blood flow is increased. It decreases inflammation, and it provides the cellular reserves for the cell not only to operate, but to repair itself. And in a lot of these things, if you can send a signal through a nerve, we get semi-paralyzed people, but who can wiggle their toes. If we can send a signal through that nerve, a lot of the times that we can use rehab techniques or use stem cells with it or use the Synexus and actually get full motor capacity back to that system. I would say that the intercellular healing, restoring the nerves, and then Synexus is done as a continuum. You use, if you're doing, let's say, 10 visits in a row, you will use 10 different frequencies sequentially to first rebuild the cellular reserve, stop the pain, increase the signaling. And so you target different things as you go. And again, I would say that the waveform of the Synexus enables it to do that. What exactly that waveform really looks like by the time it's modulated all over the place is an item of conjecture. I don't think anyone really knows. I don't know. But what we know is that it's probably the most elaborate energy that anybody's putting into another person without doing the brainwave scanning and the neurofeedback kind of stuff.
Thank you. So it looks like we have our last question here for the evening. Why is there all these changes in the signals?
So again, this was specifically designed to mix up the signals so that the nerves don't create a condition called habituation. When there's habituation, whatever you're doing stops working. And so that's why there's been a plateau or a delimitation where things stop working with E-stim. So what we know is people are very fond of their electronic stim or their TENS machine from a pain point of view, but they have the same condition for years. This basically solves that problem by very, very overtly mixing up the signal. And at a certain point, what we know is the nerve almost like is pre-set up to regenerate if you can get enough of the stimulation into it. So those signal changes are probably the key to Synexus being effective and working as well as it does. So one of the things we do is we'd encourage you to share this information. Like most things that are new, your GP probably hasn't heard of it. Your general practitioner's knowledge of rehab technology is probably pretty limited because it's not something that they refer to on a normal level. But every person that's listening to this knows 10 people with peripheral neuropathy that would benefit from this. So, we kind of consider ourselves the people's regenerative clinics. So we have people that clinics we know that do exactly what we're doing, but only at the extremely high end. The great thing about Synexus is now this is available to almost anybody. The cash plans are not that expensive. The Medicare reimbursement is really good. And then there's regular insurance reimbursement on it too. So it can be paid for either partly or wholly. It also enables you to address a problem that's kind of insidious. So when we test for this, in about 50% of the people, they didn't realize the level of nerve damage was where it is because it's happening slowly. And a lot of times it's the numbness tingling thing. So it's not pain. It's not something that they would really pay a lot of attention to. But as we get older, that lack of sensory capability coming from our hands and our feet is one of the hugest things that causes either falls or lack of coordination or inability to kind of enjoy your life. So Synexus is a quantum technology that enables us to put people back on track. And again, when we do this with stem cells, we're making very significant changes in very short amounts of time.
That's it for the questions for today. I'll go ahead and end this webinar.
And we'll talk to you next time.
Sorry, can you hear me? Perfect. If you guys have any further questions, I left a chat box at the bottom. We'll go ahead and review that by today and then get back to you as soon as possible. You can also visit us at www.advancedregen.com/neuropathy. If you're ready to schedule your consultation, you can give us a call here at 408-871-8222. Thanks again for attending. I'll leave our phone number in the chat box.